I've recently read some references to something referred to as white coat hypertension. Could you expand on what that is and whether myself or the viewers have to worry about that specific type?
Absolutely. So, I mean, this white coat hypertension is a pretty common problem. On a busy day, we see close to 100 patients. Out of them, I can say that at least 30% of these people do have high blood pressures. And they'll be surprised and sometimes annoyed saying that, doctor, the blood pressure at home is perfectly normal. What happens to my pressure when I come to your office? It's called as white coat hypertension because most of the time these blood pressures are checked by the doctors and nurses wearing a white coat, and possibly because of anxiety and nervousness and driving in the traffic, waiting for the doctor in the waiting room. All of these factors do raise the blood pressure. The same patient, if she goes back home and after a relaxed moment, if they check the blood pressure is perfectly normal. In the past, there was a major controversy like, do we need to be worried about? The answer to that question today is yes, you need to be worried about, because this is life, and every day is not pleasant and every moment is not pleasant. There's ups and downs every minute and every second. We all have emotions, we all have problems, and which simply means that when you are at stress, when you're mentally or physically at stress, your blood pressure is out of control. There are many occasions in a given day, 70, 80, 90 occasions in a day, in a human day of 12 hours, which can predispose you to very high blood pressure swings, and these swings in the blood pressure are as dangerous as persistent hypertension. So the answer to that question is yes, it's a common problem. We see it pretty often and it needs to be treated.
Now, I've heard that there's a new way to treat hypertension via a cautery. Could you expand on that?
Yeah, there are many new modalities of treating hypertension, not just with the medications, but these days we are working on a technique using a catheter and the microwave technology to burn the renal sympathetic nerves around the renal artery. There is some data from Europe showing a very significant drop in the blood pressure, and these people were successfully taken off all the medications eventually in a matter of 3 to 6 months' time, and we are on the verge of getting that technology at our institution, and very soon we'll start enrolling patients into this trial to see if this catheter-based treatment will be effective, safe, and efficacious in treating this very common problem.
It's very interesting to know. Well, as a final question, you've gone over a lot of information with us. You've let us know what hypertension is. You've let us know some of the contributing factors, some of the treatments. If you could sum up in a short number of preventive measures, what would be the best ways for your viewers to prevent hypertension?
Again, I would like to reinforce the same thing, that obesity is the main thing. Every possible effort needs to be done to lower your weight. Number two, if you salt intake need to be watched carefully. All of us buy canned foods, which is not a big deal, but again, you have to make sure that you read the sodium content on the food labels. It's mandatory now by the FDA that any food products sold in any departmental or any of the stores have to have a sodium content, and it's very important that you take a look at it before you buy it. Third thing is very common is in the restaurants, especially the ethnic foods, including Japanese, Korean, or Chinese food. They have all kinds of sauces which have MSG, including the teriyaki sauce and all these things. So if possible, don't make it a habit to visit these restaurants on a regular basis, so you got to watch what you eat. And the third important thing I would like to say is that get onto a regular exercise program, 30 minutes of brisk walking. Viewers, that's your time, no cell phones, no phone calls, no family. 30 minutes of your time is well spent. And not just talking like a doctor, but again, it's very important that you liberalize fruit and vegetable intake. It does have a lot of medicinal properties. It is full of potassium, magnesium, and several other electrolytes. All of these have inherent tendency to dilate the vessels, lower the blood pressures. And if you feel that the blood pressure is getting out of control, it's very important that you speak to your healthcare provider. Most of the time, some fine tuning of the medications need to be done. And if you're on medications, it's very important that you take your medications on time. Hypertension is a lifelong problem. Once you're diagnosed, you will have it for the rest of your life. With the numerous medications and the therapeutic modalities what you have available these days, it's easiest and simplest disease to treat. So compliance with the medication is very important. And I would also like to mention the viewers that it's very important that you buy one good blood pressure instrument so that you could check your blood pressures on a regular basis. It's a good investment for the rest of your life. All of your family members can use it and get the maximum benefit. And Yves, one common question which my patients ask all the time is that, when should I check the blood pressure? This is a very interesting question. We all work, we all have to work to make a living, and ideally the blood pressure need to be checked after 9 a.m. Do not check it before 9 a.m. because when you wake up early in the morning, there is a significant hormonal surge and the blood pressures are inadvertently high in all of us. So do not check it before 9 a.m. Check it after 9 a.m. and in the evening, if you're free, check it between 7 and 8 p.m. That's the best time to check the blood pressure.
Well, Dr. Palola, I really appreciate your time that you took today. I think you've given us some very good information to use in our daily lives and a lot of information to think about. So I do want to thank you for being with us today in the studio.
Thank you, Yves.
Viewers, if you want to, you can schedule an appointment to see Dr. Palola at his office. You can reach him at 337-988-1585. You can also reach him at his email address, which is drpatlola@hotmail.com. That's drpatlola@hotmail.com. We'll be back next week with our next topic, which is going to be stroke. So I'd like you all to join us for that. And until then, please stay healthy and have a great night.